Welcome to the Bodacious Women in Cannabis podcast, the show where the bold and brilliant women cannabis business leaders share their journey and their expertise. Here's your host, Susan Burns.
Hello, this is your podcast host, Susan Burns, and as a lawyer by profession in the cannabis industry, nothing delights me more than showcasing bodacious women in cannabis. Today, we are talking with Berta Kaguako, and she is a medical cannabis patient advocate. And I think you're the first medical cannabis patient advocate I've spoken with. Welcome, Berta.
Hi. Yes, we're a rarity. Thank you.
Well, thank you for doing what you do. So, how long have you been a cannabis patient advocate?
So, not long now. I have been a patient advocate for about 6 months now.
And what got you into that?
Yeah,
What led you into that?
So what sort of led me into that is I myself am a medical cannabis patient, and I mean personally, I don't feel like I had as many barriers as other patients do because unfortunately, due to medical cannabis still being very heavily stigmatized, we patients have to face something that no other patient actually has to face, which is criticism and discrimination when dealing with whether it's law enforcement officers, whether you're going to the hospital appointment, whether you're dealing with work situation. I've been fortunate enough to not have many of these concerns. However, I was briefly the CQC registered manager for a medical cannabis clinic here in the UK. And
Hold on. You were a what manager?
Yeah, so what that means, so CQC registered manager. So the regulatory health care provider in the UK is CQC, the Care Quality Commissioners, and under the
Okay, and you're in the UK.
In the UK, yes. And under the Health and Social Care Act, you have to have a registered manager who is legally responsible for the clinic and ensuring clinical governance, regulatory compliance. And as part of my role there, we dealt a lot with patient complaints. And I suppose we're subpoenaed often by courts, by children and families, by the police services, because patients' prescriptions. Now, I have been a healthcare professional for many years in a senior management capacity, and I've dealt with patients from substance misuse to mental health, and never have I come across having to justify a opiate prescription. However, when it comes to medical cannabis patients, I started to notice a very, very big trend. And that's sort of what inspired me to just, I have a big mouth for the record. I've got ADHD. I cannot keep quiet. And, where I, as a patient, struggled as well to find my voice. When I finally did, I said, you know what? No, I'm not standing by this. It's a difficult enough experience that we experience in life in general, just trying to navigate your way through life as a patient. So as somebody who has a, unmet healthcare need, to have to deal with all of this on top of that, where no other patient has to actually deal with this. It was just too ridiculous for me, and I started speaking up. Does that answer your question?
Okay.
It was really long.
Yeah, it does. And you started speaking up before you were in your current position, or
No,
as part of your current
as
position?
part, yes, as part. So that's not my current position. I've moved on from there, and I do a lot of consultancy now.
So you started advocating in your prior position, even though that wasn't part of what they
Yeah,
retained you for.
yeah,
Okay.
yeah.
All right. And then how did you arrive in your current position where
So now,
your title is patient advocate?
yeah. So basically, after speaking up, I started speaking at I believe it was a patient conference for the Cannabis Industry Council, where I shared my experience both within the healthcare sector and as a patient. And I was approached by one of my colleagues now to join their patient platform. So we are currently known as Sunscara platform, but we are rebranding as we are registering as a charity to Patients Can. And I've been with them now, yeah, for the last 6 months, helping them navigate the their way through registering as a charity, and we offer a variety of different services as well for patients.
So describe what you offer. What types of things do you do?
So basically, the platform, and I'm going to refer to it as Sunscara just because it's still known as Sunscara right now. But
Can
the
you spell that
Sunscara,
for us, Berta?
yeah,
How do you spell Sunskara?
Sanscara.
Okay,
Yeah, the
thank you.
Sunscara platform. And so basically, it was funded by Mohammed back in early 2022. Towards the end of the year, he did register with the Cannabis Industry Council here in the UK and became a non-profit organization. The point of patient, okay, now I'm getting myself confused. Sanskara. When I reckon that's one of my symptoms, so get used to that. But yes, so the point of Sanskara is to offer patient advocacy. So we do a lot of different things. One of them is peer-to-peer support. So what that means is whenever we have patients that have any issues, whether it's at work, whether it's in the community, whether it's at home, it's usually at work or by the police. They would get in touch with us and we would support them and signpost them to various different organizations that can help. On the website, we have a variety of different information. So it varies from a few publications that Mohammed has done. We have done a few publications on medical cannabis awareness. We have done a few publications on um, ensuring that there's information there for all of the different clinics and the different pharmacies in the UK, guidances around driving, guidance around work, and legislation around that. There's a lot of different materials that's available there, and we sometimes redirect them to these materials or we help them. For example, a recent one was a patient was challenged at the hospital, and they were in A&E and were refused to take their medical cannabis medication.
What's A&E?
Oh, sorry. Accidents and emergency. I keep forgetting the two
Okay.
different countries. Yeah. Also, the emergency unit at the hospital, and they were refused their medication, and naturally got in touch with us, and we're helping them to put forward a complaint. So we do a lot of different things. Sometimes it's just hand holding and just supporting the patient when they are just feeling a bit overwhelmed, and sometimes it's something more in depth, as in supporting with complaints. We also do roadshows, so we go out to different parts of the UK. Some of the areas we covered last year were Kent, London, Brighton, and we would do some workshops and showcase various different vaporizers, various different terpenes, show people how to vape, make it aware to people that medical cannabis is legal, because some of the stuff that we also do while we're out on these road shows is trying to encourage people who use recreationally, sorry, that word's not happening for me today, but people who use illicitly to transfer onto a prescription and sort of recognize that they're self-medicating. My background's in psychology, so I like to do a lot of education around that, and it's in substance misuse as well. Um, and we try to transfer them over to a prescription, speak to cannabis naive patients who might just have some queries around their medication.
I
And
like that phrase, cannabis naive.
oh, is
That's
that
a
a
good
UK
phrase.
phrase?
I don't know. I haven't heard it before. It may be used in medical cannabis here. I'm more on the recreational side, but
Yeah,
yeah,
okay. I didn't
cannabis
realize
naive,
either.
good phrase.
So a lot of the times they would be the most nervous patients because they are aware of all of the stigma, but due to desperation have decided to try medical cannabis and are just very nervous. And it's just around guiding them and educating them on the medication and helping them to understand how you can use this medication as part of a holistic approach to your healthcare. We don't want to get into the habit of general healthcare providers here who just prescribe, prescribe, prescribe. We want to ensure that people are using their medication, I suppose, safely, responsibly, and are not
Effectively, right?
effectively. That
Also, you
thank you.
want to
That
make
is the
sure that
word.
it You want to make sure that it's a whatever type of prescription that works for them.
Yes, exactly. So yeah, so we do a lot.
I think there's a misperception out there that all cannabis is cannabis and you know, that it's the same for everybody, and it isn't. It hits us
No,
all differently,
yeah.
and there's so many cannabinoids and terpenes and different compositions. It's a miracle plant, in my opinion.
Oh no, I say this all the time. I've said it before. I've said it to other people, and I've explained to them. I truly feel this is some kind of witchcraft. I was like, what sorcery is taking place with this medication? It is just way too effective. I mean, for myself, I have 7 diagnoses and 38 symptoms, and prior to medical cannabis, when my health sort of deteriorated after COVID, I and long COVID. I was bedbound at least 5 times a week. I could barely function or do anything. And medical cannabis sort of like managed all of these symptoms where I was taking at least 9 different prescriptions with my, conventional healthcare and I don't know, pharmacological, whatever you want to call it. Um, it was mostly all replaced with medical cannabis, and I don't know how it does it. It's juju. It's juju. Sorry, juju is African slang for
It
witchcraft.
is,
It's
but
juju.
we also do have an endocannabinoid system, which makes it more likely to be effective than synthetic pharmaceuticals. But not to everything has its place, of course. But what Berta your favorite part of what you do? What makes your heart sing the
Um,
most?
do you know what? Yeah, empowering patients. And it's not just about feeling comfortable to use the medication, but actually empowering them to have a holistic approach to their healthcare. I am a strong believer of a holistic approach, and I feel that a lot of the times, just in healthcare in general, yeah. Doctors, consultants, whomever is treating you are essentially just treating one part of you. And when you have a chronic illness, it just, I don't even know, it has a ripple effect on the entirety of your life. Every single aspect of your life is impacted. And these are things that are not taken into account. So just because your physical health, let's say you start the medication, it's now being managed, because so much damage has been done in the process before you got to a point where your physical health is now stable. Because unfortunately, a lot of the times, especially with chronic illnesses, it could take up to 2 years for your health to stabilize, meaning you've got difficulties at work. A lot of people have already left work, and just having people be able to pick up the broken pieces of their life again and just supporting them to do that, because that is not an easy thing to do. I don't know what is going on with my road today. That is not an easy thing
Oh,
to do. And just being part of that journey with the like, yeah, that's what gets me up out of bed.
nice. How about the most frustrating?
Um, the most frustrating is people, healthcare professionals, whether it's the industry or outside the industry, just not working together. We all have the same goal, and that goal is supporting patients and helping treat patients. It doesn't matter what medication that patient is using, if it's helping them, especially if it's helping them much better than the medication you were prescribing, then that should be taken into consideration. The fact that I even have to say that, I shouldn't even have to say that. It should just be a given, and then get on with the treatment. There's too much judgment. There's too many healthcare professionals just not working alongside each other. And I just feel that what's being lost is the patient. It's all about this and finances and that. And there's so many different things that everybody wants to make it about, but patients are not at the forefront anymore. And that is part of why we are revamping Sunscara into Patients Can, because we want to bring patients' voice and representation back to the forefront. And it's a crucial thing of what we do. I think one of the things I forgot to mention earlier was that last year we won the Best Medical Cannabis Advocacy for 2003 by the Global Health and Pharma. And we have been nominated this year for UK Enterprise Award. So, you know, we we just want to be able to get healthcare professionals and patients to work together so that we can start addressing a lot of these concerns. And I feel that no one's working together. No one.
Mm, hard, yeah. Yeah, well, just even in the regular medical system, I don't know what it's like in the UK, but here, if you have a headache, you see one doctor, and then you see somebody else for your back and somebody else for
Mm,
your foot and
yes.
somebody. I mean, it's like you're the medical profession has you already, you're already dissected
Yeah, yeah, yeah.
and you're not a cadaver, but it's like, and nobody's looking at the whole. That's just medical without, you know, the need for the vast need for education in cannabis, whether it's medical or any other like judiciary or lawmakers or, I mean, and it's a huge learning curve, right?
Yes.
To learn about the plant and what it does and all its properties and what's safe and what isn't and all those things. It's complex, so not to think that everybody should be aware of all the things, but to make the time to be educated, and allow yourself to be educated, I think. Would you agree with that?
And I think, yes, yes, I'm over here smiling because you hit the nail right on the head. Allow yourself to be educated. So we face the exact same challenge over here. Again, I just like to use myself as an example. I've got 38 symptoms. Some are musculoskeletal, some are nerve system related, some are bone. And so I'm open to various different departments. They do not speak to each other.
Why would they?
I
That
have
would
no
make too
idea
much
why they
sense.
would. Yeah. No, but I agree. The willingness to learn, especially when it comes to medical cannabis, because again, it's cannabis, it's associated with delinquency. And so the minute you even mention the word medical cannabis, no one even wants to know about it. I would often try and educate my healthcare providers and say to them, like, but you need to know a little bit. And they're like, oh, well, that's between your doctor over there. And I said, well, no, actually, you need to know all the medication I'm being prescribed because medical or cannabis, full stop, impacts the enzymes in your liver, which can interact with the medication that you are about to prescribe me. So you need to actually know this medication. And that's how I get them to finally sit down and agree that, from a healthcare perspective, I guess I should know. But again, I can say that because I have this knowledge. I've worked in the sector, I've worked in healthcare. Somebody like the ordinary patient, they wouldn't be able to advocate for themselves in this way. Sorry, I'm gonna keep going on and on because I get really annoyed when I start talking.
Yeah, I know, and not even to ask the forms they ask about your tobacco use, your alcohol use, and then they ask about drug use. Well, if I use that's recreational, so they wouldn't necessarily ask about that. Or, people, we have a lot of hemp in Minnesota, the hemp derived products that have THC that, as you said, would interact with other medications. There's just such a big gap in knowledge, I think. But well, I what do you have any advice for people who are wanting to be in the field of patient advocacy, or maybe patients who don't have an organization like yours?
The first, okay, to answer the first one, my advice would be speak up, tell your story. I think the more of us that speak up and explain to people, sorry, let me rephrase that again. Speak up, tell your story. I think it's really, really important. Unfortunately, because cannabis is associated with delinquency, with so many different things, and particular substance misuse, a lot of people have this sort of notion that we're taken to legitimize our use. And I think when people start to understand that actually prior to me taking medical cannabis, I was on 9 different prescriptions. I was bedbound. I could barely function as a human being. And well, I just didn't even want to live. Like, it was such a horrifying experience, and how medical cannabis sort of transformed my life in that way. Once people hear that, they start to understand actually these are genuine patients. So I think the more you speak up, it is very, very nerve wracking. I do get it. Like, sitting there and being so vulnerable and exposing all of your, I suppose, what we would consider flaws. Uh, but at the same time, I think it's really, really important too, because this is what's going to empower more and more people to get on a prescription, and also the people that are using their prescription to feel confident and comfortable using their medication. And in terms of not having representation, if you're in the UK, hit us up. We will help you. And there are a variety of different services across the globe. So whatever part of the world you're living in, they do have patient advocacy. It probably just sorry, might not be so popular, but if you were to Google it, you would be able to find out.
Okay, so do the internet search for patient cannabis, medical cannabis patient advocacy near you.
Yeah, I am terrible with remembering anything. So I do know a lot of various different acronyms, but I can't remember them right now.
That's okay. We don't need acronyms. People can use the internet. Hey, Berta, I'm going to ask you this. What makes you uniquely bodacious?
For me, it's such a weird question. But for me, I sort of feel like my bodaciousness comes from my I suppose my drive and my passion to support people, and that's always been throughout my entire life. I've worked in the healthcare sector. I've always wanted to support people, and I've always ensured that I maintained my integrity throughout the whole process. And I know there have been times where people did try and do, and I'm like, nope, because at the end of the day, it's not about a career, it's not about money, it's about patience and improving people's well-being. And I know for myself how much my well-being has improved, having used services, and this is even before medical cannabis, and why I went into healthcare sectors. And it took me a while to find my voice, and now that I have, I am not keeping quiet. And
Well,
I
I want to ask you about that. What drives that? I mean, a lot of people help other people, but what's underneath it? What what makes you Berta, and what drives your drive?
What drives it? I guess it's because of my own experience. I've used services growing up, and it again saved my life. And that understanding that just having one person that actually cares makes a whole difference to your world. And had I not had this opportunity, I don't know where I would be in life right now. And so to be able to give that opportunity back to other people is, for me, just what gets me out of bed in the day. I couldn't work anywhere else. I couldn't do anything else. Like, I just wouldn't be happy. So,
Nice. And where can we find you? Where
oh
can people
God.
find you if they want to reach you? Or
So
can we follow
do
your organization or?
yes. So I'm going to give you the Patience Can details, actually, because I believe by the time this is aired, we will be Patience Can. So if you can find us on Patience Can, so that's PATIENTSCANN.org.uk. Or you can find me on LinkedIn. My name is Berta Kaguako, so that's spelled, oh no, I think it's actually written there at the bottom. And through there, you will see I am linked with Patients Can through there as well.
So let's spell it Berta, Berta, Kaguako is Kaguako.
Yeah.
Yeah, great. Thank you, Berta, so much for making time out of your what I'm sure is a very busy schedule to talk with us today.
No, thank you so much for having me. Again, any opportunity that we get to advocate for patients, I am all on board. So thank you so much.